Welcome to Catalyst Med Up, where we ignite understanding and make learning easier. In our today's class, we shall be discussing on the intermuscular spaces. The intermuscular spaces, they are the potential spaces that are located at the scapular region. So the potential spaces that are located at the scapular region, they are known as the intermuscular spaces. So that is just the brief introduction to the intermuscular spaces. Formation. Intermuscular space, they are formed by the following. 1. Medial aspect of humerus. Medial aspect of humerus. 2. Lateral border of scapula. 3. Teres major. 4. Teres minor. 5. Long head of triceps brachii. Long head of triceps brachii muscle. These are the structures that forms intermuscular spaces around the scapular region. The medial aspect of the humerus, the lateral border of the scapula, teres major, teres minor, and the long head of the triceps brachii. There are 3 potential spaces at the scapular region, 2 at the upper part and 1 at the lower part. At the upper part, there are 2 potential spaces, the quadrangular and upper triangular. The quadrangular is at the lateral side, while the upper triangular is at the medial side. Then at the lower part, there is lower triangular space. This diagram will be showing us the intermuscular spaces. We said that the intermuscular space, they are formed by the lateral aspect of the humerus. This is the lateral aspect of the humerus. They are also formed by teres minor and teres major muscle. This is the teres major, and above it is the teres minor. Also, they are formed by the lateral border of the scapula. So this is the lateral border of the scapula. This is the lateral border of the scapula. So now, above here, we are having upper quadrangular space. This space here is our quadrangular space. Which is at the lateral side, and medial to it, there is upper triangular space. So this space here is our upper triangular space, and below them there is lower triangular space. This space here is our lower triangular space. So here it might look jumper because here is showing us both the structure, their boundary, as well as their content. But this diagram here will allow us to understand their borders very well. So above here, this is teres minor. This is teres major, and this is the humerus. This is the humerus, and here serve as the lateral border of the scapula. lateral border of scapula. Here, this is the long edge of the tricep brachii. Long edge of triceps brachii muscle. So above here, this is our quadrangular space, and this is our upper triangular space. Below here is our lower triangular space. Now, let's take this space one by one so that we can understand their borders as well as their content. The first one is quadrangular space. Quadrangular space. The quadrangular space is bounded superiorly. It is bounded superiorly by the following structures. One, subscapularis in front. Subscapularis muscle in front. Loose capsule of shoulder joint. Loose capsule of shoulder joint, and the lower border of teres minor. Border of teres minor. These are the structure that bounded the quadrangular space superiorly. Now, inferiorly, it is bounded by the upper border of teres major. Inferiorly, it is bounded by upper border of teres major, and medially it is bounded by the lateral border of long head of triceps. Lateral border of long head of triceps brachii. Then laterally, the quadrangular space is bounded by the surgical neck of humerus. So these are the boundaries of quadrangular spaces. Subscapularis, okay, superiorly, subscapularis in front, loose capsule of the shoulder joint, and lower border of teres minor. Inferiorly, it is bounded by the upper border of teres major. Medially, it is bounded by the lateral border of the long head of tricep brachii, and laterally, it is bounded by the surgical neck of the humerus. Next thing is the content of quadrangular space. The content of the quadrangular space contains two contents. One, axillary nerve, and two, posterior circumflex humeral artery. Posterior circumflex humeral artery. So these are the contents of the quadrangular space: the axillary nerve and posterior circumflex humeral artery. The next one is the upper triangular space. Upper triangular space. The upper triangular space is bounded superiorly by the lower border of teres minor. Lower border of teres minor. It is bounded inferiorly by the upper border of teres major. By upper border of teres major, and it is bounded laterally. It is bounded laterally by the medial border of long head of tricep. Long head of the boundary of upper triangular space. Superiorly, inferiorly, and lateral. It is triangular, it does not have medial boundary. Now, the content of the upper triangular space contains only one structure. Contents it contains only one structure, and that is circumflex scapular artery. Is the circumflex scapular artery. This circumflex scapular artery interrupts the origin of teres minor and is divided into the two slips, the upper slip and the lower slip. In between this slip, there is circumflex scapular artery. So the next one is the lower triangular space. Lower triangular space. The lower triangular space is bounded superiorly by the lower border of teres major. Lower border of teres major. It is bounded medially. It is bounded medially by the lateral border of long head of triceps, long head of triceps brachii, and it is bounded laterally by the shaft of humerus. Shaft of humerus. It is also triangular. It does not have inferior boundary. It just have superior, medial, and lateral. While by the upper triangular have superior, inferior, and lateral, does not have medial. Now the content of the lower triangular space. Content of the lower triangular space is 1. The radial nerve. The radial nerve, and 2. The profunda brachii artery. The profunda brachii artery. The profunda brachii artery is the largest branch of the brachial artery. So these are the contents and the boundaries of intermuscular spaces. So from here now, this is our quadrangular space. We can see that above it there is a lower border of teres minor. So superiorly it is bounded by the lower border of the teres minor. Below it, it is bounded by the upper border of the teres major. This is the medial aspect of it, and this is the lateral aspect of it. Medially, this is the long edge of the triceps brachii, and this is the medial border of it and the lateral border of it. So medially, it will be formed by the lateral border of the long edge of the triceps brachii, and laterally, it will be formed by the surgical neck of the humerus. That is for the upper quadrangular space. Now, for the upper triangular space, we can see it has superior boundary, inferior boundary, and the lateral boundary. It does not have medial boundary. The superior boundary of it will be formed by the lower border of teres minor, and the lower and inferiorly it will be formed by the upper border of teres major. While by laterally it will be formed by the medial border of long head of the triceps brachii. This is the medial border of the long head of the triceps brachii. Coming down to the lower triangular space, it has a superior boundary. It has medial boundary and the lateral boundary. It does not have inferior boundary. Above it, we can have this is the lower border of the teres major, so it forms the superior boundary of the lower triangular space. Medially, the lateral border of long head of the triceps brachii, and laterally it is formed by the shaft of the humerus. So this is about the contents and boundaries of intermuscular spaces. Kindly subscribe, like, comment, and share. Don't forget to turn your notification bell so that you don't miss any new video.